My name is Shirley Peterson. I'm the head of midwifery at the Homerton. Thank you so much for taking the time out today to come and hear about how Homerton has responded to COVID and our plans for the future. So I've got one slide which I will be speaking to, and then happy to take some questions as we go along, but I'm happy also to take any at the end of the presentation. So, are you going to share the screen, or shall I do that?
I can do.
Brilliant.
I will do that.
Thank you.
Okay, no problem. Let me just open this. Okay. Sorry. Here we go. Can you see the screen?
Not yet.
No. So I don't know what's happening. That always happens in a meeting. There we go. Can you see it now?
Yeah, just about to. It's yeah, there we are. Perfect.
Excellent.
So what I was planning to do was really to go through each of the pathway that a woman goes through when she's having her baby. So as the slide, you can see on the slide, there's a section on the antenatal care, and intrapartum care means care during labour and care while after she's had her baby in hospital, and postnatal care. So I'll go through all of the individual sections, and as I say, stop me if you have any burning questions, or I'm happy to take questions at the end. I think it's important to first say that, like every other service, the pandemic came very, very quickly, and we had to make some very, very quick changes to our service and to the pathway to respond to the evolving pandemic. We recognise some of these changes that we made were difficult and challenging, but as the virus was new and we didn't know kind of what we needed to put in place to keep everybody safe, we felt we had to take these measures. But we very, very quickly were able to reinstate some of the restrictions that we put in place. So I'll just go through them now in terms of this is where we are today, and these are the services that are in place. So in terms of antenatal care, we are doing a combination of, so when it's your first appointment with a midwife, that appointment is a combination of face-to-face and a telephone appointment, and that would depend on the woman's needs, and also particularly if there's any language considerations that we need to take into consideration. We are planning from the beginning of November to revert all of our first appointments with the midwife back to face-to-face, because we really feel that women value that face-to-face human interaction with a midwife at the first appointment. So that's our plan going forward. In terms of antenatal classes, we had to stop those because of the social distancing and the infection prevention measures that had to be put in place. So we're not offering those classes via video link on our web page. So I hope if you've not seen it, you'll be able to look at those and give back any feedback that you feel will be helpful to us. We also have a virtual tour on our website as well, so that gives you an indication of what the services look like in terms of what our antenatal care, antenatal clinic, our scanning department, our labour ward and postnatal ward. Up until last week, women were only permitted to bring one adult with them to their 20-week scan, but I am so pleased to report from yesterday we were able to introduce that partners or one adult is welcome to attend with the woman for her 12 and 20-week scan. So in terms of additional scans, so there will be some women who require additional scan depending on what the advice from the midwife or the obstetrician. We will decide on a case-by-case basis whether we can permit somebody to be with the woman at those appointments. The reason why we are having to have limited visiting in terms of scanning is because the waiting area within the scanning department is very, very small, and to be able to facilitate social distancing, we had to put think of some innovative ideas to be able to support partners at the scanning appointments, because we heard very, very clearly from our women that they very much value having somebody with those appointments. So we're pleased to report we've made those changes. And also we really, really would like you support in ensuring that when you do attend for those appointments, if you could make alternative arrangements for if you've got existing children. We are really trying to not to have any children in the department. And I know that might be tricky if you don't have anyone to look after them. And if you do, if you must bring them, bring your child with you, can you please let us know ahead of time, and we may then need to move your appointment later down. So to be able to facilitate the additional space that may be required. In terms of labour care, we are all maternity staff and the trust-wide staff are also following the guidance in terms of wearing masks. So when you come to the hospital sites, for any reason, you'll see even along the corridors, all irrespective of what service you provide, or doctors, nurses, midwives, support staff are all required to wear a mask. And when we're caring for you on the ward, we're also required to wear a mask, as well as an apron and gloves. And that's in line with the public health requirements to keep everybody safe. Our birth centre remains open, and we are supporting and facilitating women's caring labour for women who are low risk, and you'll be able to access water birth if that's what you choose. Women who have got COVID symptoms, we are recommending that they birth with us on the delivery suite and not in the birth centre, because we would like to provide additional monitoring which cannot be done on the birth centre. We have a home birth service that still continues, and we're committed to continue to supporting women who wish to have a home birth. We're also supporting women who wish to have 2 birthing partners with them during their labour, provided obviously they mustn't have any COVID symptoms. And if the birthing partner that you've chosen does have COVID symptoms, then they mustn't attend with you, but to call us ahead, and we can discuss with you about what other alternative arrangements that you can put in place to support you during your labour. We really ask that whoever you identify birthing partners are, that do not swap, because we're trying to limit the any kind of potential exposure risk. So if you identify 2 birthing partners, they must be the 2 that stays with you for the entire duration of your labour. In terms of hospital, so after care after having your baby, so if you or your baby does develop COVID symptoms, then we would provide care in a single room, and you would have a midwife who will be providing direct care for you, and that midwife will be wearing the full PPE as described previously. We also, I forgot to mention that on entrance to the hospital, the woman and her birthing partner will also be asked screening questions. So those questions about whether they have got any temperature, a new persistent cough, and if any of those responses are yes, then you will not be, unless you're in established labour. But if you're not in established labour, then you will be asked to return home, and your midwife will contact you. Also, when a woman comes into hospital, we offer COVID swab routinely to all women. So if a woman's been admitted, we would offer COVID-19 swab to them. We are not offering swabbing to partners at the moment. We're just offering the screening test. Screening questions, I beg your pardon. So hospital, whilst you're on the ward, we will ask that you wear a mask, and that's actually in labour as well. But obviously, if you are requiring, if you need an enterox, which you would need quite often during your labour, then obviously that's not compatible with wearing a mask, so you don't have to wear a mask. If you're choosing to just use breathing techniques during your labour, then of course you won't need to wear a mask also. but it's just to keep us all safe that we're encouraging everyone to wear a mask. Obviously, we can't insist on this, but we understand that this there is evidence which tells us all that wearing masks help to reduce the spread of the virus. So we would welcome your support with this. Also, obviously, no need to wear a face mask when you're sleeping or when you're eating, but any other time we would encourage you to do so. We continue to provide breastfeeding support on the ward, and there are midwives and support workers available to support you with that. And from the 6th of July, we have been permitting one birthing partner to visit the woman on the ward, on the postnatal ward and the antenatal ward from 2 till 6 p.m. But also we would ask that that person is, if wherever possible, is within your household, and also not to swap, and also no children, I'm afraid. And once you go home, you'll get visits from a community midwife. We'll also, if required, we may do some video visiting, so we'll do some telephone visiting as well. If you feel it's safe to do so, then we will visit you in person, but the majority of our visits does happen in person, and the midwife is required to wear a mask, apron and gloves as described. We've also got a video which is on our website, which talks about supporting you and guiding you through the first few days and weeks of having your baby, and supports for feeding techniques. So that's also available on our website. That's the brief summary of the presentation as it is. I'm happy to take any questions.
Excellent. Thank you very much, Shirley. Do you mind if we share this after the event, after the meeting?
No, that's absolutely fine.
Yeah. Is attending. Excellent. Okay. Any questions?
Catherine's got a hand
yes,
up,
Catherine.
Yes, just you were saying that you're not having any face-to-face antenatal classes, but you've got classes. Just wondering, what's the situation for people who aren't online? I mean, I'm thinking particularly of the Shirley community in Hackney who generally aren't online.
So what we are offering is their midwife will be able to, so at the 36 weeks appointment, the midwife should be going through a birth planning section, and that's available for all women. And I would expect the midwife to go through any particular questions or queries that a woman may have in terms of her labour and birth and the immediate postnatal period. So we can offer a bespoke kind of face-to-face opportunity to ask any questions relating to pregnancy and birth, and also not just at 36 weeks, but throughout the pregnancy, because that should be a fluid conversation with your midwife about any questions that you may have. But certainly at 36 weeks would be an opportunity where there's any specific questions around birth that could be asked during that appointment.
Okay, so I think 36 weeks is quite late, really, isn't it? It's only like about a month before you're due to give birth. So you could easily go into labour early, couldn't you?
Yeah, absolutely. But so we do ask to say there is an opportunity, because that woman will be seeing her midwife or a team of midwives that questions could be asked during that, at the start of the pregnancy and throughout. And if there is a way where we could share that information that's not through our website, if there is a way that you think would be beneficial to share the information that we already got on our website through that community, then by all means we can definitely explore that, because we don't want to disadvantage anyone.
Yes, okay, that's really useful. We'll give some thought to that. Thank you,
That would be really, yeah, that would be really helpful for me. Absolutely.
I would like to ask a question. So, Shirley, I guess this is another question for a midwife, but if the woman in labour has coronavirus symptoms and she gives birth, will she be separate from her baby, or will
Absolutely
they be
not.
in the same
Absolutely
room?
Not. So mum and baby will be separated, from what's a better word, in terms of if that baby is unwell and requires admission to our neonatal unit. but mum and baby are not separated because she's got positive to COVID. Absolutely not, no.
Excellent. All right, that's really good. Thank you very much. I guess this might be a worry for many expecting mums at the moment.
And we are certainly at the height of the pandemic, there were some real concerns, because I know, not in the UK, but in some other countries, they had been separating mum and baby, but we were very clear that there is no evidence to suggest why mum and babe should be separated because mum's got COVID. Absolutely not.
Yeah, and in terms of testing, will you test the mother before she actually is discharged from the hospital?
We offer,
or if she doesn't have symptoms, they will not be tested.
No. So we offer routine. So we offer routine testing to all women who are admitted, but also offer testing to mum who are coming in for planned procedure. So that's cesarean section or induction of labour. The turnaround time for the test can take up to 72 hours. So there may be the odd occasion where mum has had her baby and gone home, and then we then have the results of the COVID tests. We will of course contact mum if that result is positive and give her the appropriate advice.
But if it's negative, you won't call them. I guess that's what
we don't call if it's negative. Okay. Yes.
No. Okay. I guess people. Yeah. Okay. Does anyone have any questions for Shirley?
Yeah, can I ask a question? It's Andrea here.
Oh, yes. Hi, Andrea. Hi.
Yes,
hi.
Please do.
I was just going to ask, I suppose, what has been like the COVID experience for the maternity services in Homerton? How have staff and how have patients been affected? Has there been sort of a large number or not in terms of cases, and how have they been dealt with?
In terms of staff and women's welfare, just staff like any other member of the public has been naturally quite worried, particularly at the start of the pandemic. We do have a number of staff who are high risk, and we've taken the appropriate measures to keep them safe. So yes, it's been tricky for our staff, but we've ensured that we provide all the information we can and all the support we can, and also where it's not been safe for that member of staff not to kind of provide face-to-face care because of their COVID risks, we have redeployment to somewhere else where it's safer for them to work. With regards to women, I think it's fair to say that women have found it very difficult not having initially, when we stopped all visits into the wards. Initially, the initial feedback I was given was that actually women didn't mind not having their partners on the ward, but actually it became very clear very quickly that women did obviously wanted partners on the ward, because the level of support that was provided for their partners was not going to be the level of support that I could and my team could provide. And the partner support is absolutely invaluable, and they come as a team. So we know that that has an effect, and we were very mindful of that, and we're trying to put all measures in place to ensure that we can support some reinstating, to relaxing some of those restrictions that we put in place. Similarly to scanning, we also knew that women found it very, very difficult not having somebody with them during the scanning appointments. So through our Maternity Voices partnership, we were hearing from women, and women were contacting us also directly to ask us when we were going to relax some of those restrictions, because it was having an impact. But what's important also to say, whilst we did put the restrictions in place, we also created an exemption list. So women who we felt were going to be particularly affected, whether they had ongoing mental health issues or they had any other issues which we felt actually potentially may be worse than if they didn't have support with them, we would make those exemptions. But I was very clear that exemptions, by way of, obviously that's the way of supporting women, but by virtue of having an exemption, you are having a two-tier system. And I wanted to be able to relax some of those restrictions so all women could have their partners with them when they needed them, particularly during scanning or on the ward. So that's why we've put those. So we were one of the very few maternity services in the summer to have lifted some of those restrictions. Certainly visiting, we were one of probably the first to do that. So I feel we have been responsive, but we've recognised that it's been a really difficult time for women, and we that hasn't gone unnoticed.
Shirley, may I just ask a quick question as well? I mean, so firstly, I'm so glad.
Is that Kate?
Yes,
Katie?
Katie. Hi.
Hi, Katie. Hi.
Firstly, I'm so glad to hear that, yeah, you've relaxed some of the restrictions, particularly around the attendance of partners at the 12-week scan. Just to share from my own experience, I personally found being asked to attend the 12-week scan by myself incredibly difficult and upsetting. In fact, to the point that I refused to accept that treatment and care because I felt like it wasn't in my best interests. Had there been a negative outcome, to have to go through that by myself, in terms of my mental health and my state of well-being and my emotional health, for me, it just wasn't an option. I guess my question then is, what are you doing, or what are you willing to commit to ensure that as we enter into, I guess, a continued period of uncertainty, with obviously, COVID cases increasing, London going into tier 2, potentially tier 3 restrictions, how are you going to ensure that some of those relaxations are not stepped up again, especially when they have clear, detrimental maternal impact?
Really good question, Kate. Katie, completely agree that, and I've received some of those phone calls, but women who are very distressed about not having been told that they can't have their partners with them. So I was very mindful of the impact it was having on women. In response to your question, I am absolutely committed to ensuring that we don't get to a position that we were a few months ago. But the way so the help that I need from women and their families in City and Hackney is that they support us with the measures that we've put in place, i.e. that please try and just come with one person to those appointments. Please, when you attend, have your mask on. And I know there are some people who are exempt from wearing masks, and that's fine, but majority of us are not. So please support us by having your mask on when you come on site. We have made some arrangements in terms of seating, and primarily, Katie, the reason why we put those measures in place is just because the infrastructure, and I know this is, potentially is not a good enough response, and I accept that, but we had infrastructure challenges in terms of the physical spaces within our waiting area, and therefore it was very difficult to be able to socially distance in those waiting areas. If we just open, we took a stepped approach. So we knew that permitting partners at 12 and 20-week scan would be impossible to manage safely. So we had a discussion with our MVP, with some of our women, and we said, actually, if you had to choose between, and I know this is an impossible ask, I get it. I'm not suggesting for one woman this has been an easy decision for us to take or for you to accept. What would be your preference? And women came back and said 20 weeks, but we knew that 12 weeks also, as you described, the 12 weeks scan for some women is not, unfortunately, not a positive experience because they receive an outcome which they're not expecting. So not to have somebody there is obviously very traumatic. And we had put measures in place for those scenarios, but it's not the same as having somebody physically there with you when you receive that news. So it's a very kind of long-winded response, but a very, very short response is, I am committed in keeping these measures that we have in place now. And the only thing that would change is if there is national guidance that says we need to scale back what we've implemented, then we need to respond to that. Or if there is some concerns internally within an increased cases within the trust, which there hasn't been. We've had very, very low COVID cases, certainly within maternity. So as long as none of those measures change, I am committed to keeping these measures in place because I know they are huge benefits to our women.
Thank you. I mean, I guess just quickly, I'm following up on that. I mean, at any point in the kind of in your response, you know, is there opportunity for you to work with other hospitals in and around East London to try and ensure that, you know, those kinds of services are able to take place and women are able to take partners with them?
So yes, Katie, we work with so we are part of our local maternity system, and we work with Barts, who are close to us, and Queens, and we meet every fortnight to look at our to discuss exactly the issues that we're discussing here as the maternity services, and see actually how we can support each other to ensure that women are getting the best service and the best experience they can during the pandemic. So that work already exists with our other colleagues, and what we do is we learn from each other. So when we were able to introduce the visiting from 2 till 6, Bart said to us, how did you do it? We want to learn from you. We want to implement the same thing. But also they were able to go to their local infection control lead and say, well, if Homerton can do it, why can't we? So we actually are, you know, we are united in ensuring that women in East London get the best care that they can during the pandemic. So we definitely work together.
Great, that's really good to hear. And then just one final question, and apologies if you covered it in your presentation and I missed it, but just for those women that do have suspected COVID cases, what efforts are made to, I suppose, isolate them from other women during labour?
So, Katie, every woman, you know, and this has been in place irrespective of COVID, every woman who is in labour is in labour in a single room. So from that perspective, that issue in terms of protection and ensuring that we don't increase this increase the spread, then that kind of, it's a safeguard, because that woman is in a room by herself and is looked after by one midwife. When the woman goes to the ward, majority of our ward space is within a bay. So that's why we are working with our infection control colleagues to try and see if we can have rapid testing, so that if any of, because, you know, some of the women who have tested positive have been asymptomatic. So that's the issue, is that, you know, a woman would not have knowingly had any symptoms, so therefore it's a surprise to her, like it is to us when the test comes back positive. So if that scenario were to happen and the woman is already in the bay, we would immediately move that woman to a side room. We would explain to the women who are in that bay that obviously we will not share the details of that person, but we would say, you have been in contact, you have been in this bay, there has been a woman who's tested positive within this bay, so therefore you are exposed, and we would ask you, if you're going home, that you are to self-isolate. So there is no requirement to routinely test if you're home, because that's not in line with the guidance, the national guidance, but we would inform you that you may have been exposed. We do have some side rooms on the ward, but we only have 5 side rooms. So unfortunately, we cannot admit all women into side rooms, but we are testing as women come through the door and trying to get the testing, the results back as quickly as possible, so we can reduce the risk of women being exposed to somebody who has subsequently tested positive.
Great.
We are working through some, Katie, we are working on some comms that will go, that we will give to women when they book with us. But it's a comms that needs to be worded carefully, because I don't want to worry women, but I want to let them know that, you know, we don't have capacity for immediate tests. So there is the test that you could get a result back within 1 to 2 hours. That test is not routinely available in maternity, in trusts. So we do the testing, but the test goes off to Barts and takes sometimes up to 72 hours to come back. But in the main, it comes back within 1 to 2 days.
Great. Thank you very much, Shirley.
Thank you. Thank you very much, Kate, for the questions, and Shirley for the information. Any further questions for Shirley? Do you have any further questions for Shirley? No. Then I think Ellie Duncan from Maternity Voice Partnership.
Hi, Ellie.
Hi, Ellie. Hi. Ellie, can you hear us?
Yeah, hello. I can.
Hi.
Oh.
It's breaking up a lot. I think it's a poor internet connection there, Ellie. Ellie, can you hear us?
Can you hear me now?
Yeah, that's better. Hi, Ellie.
Yes.
Yeah, okay.
Thanks for joining, Ellie.
Hi.
Ellie, would you like to quickly introduce yourself and where are you from and what you are doing as well?
Yeah, I can introduce myself. So my name's Ellie Duncan. I actually work at the Clinical Commissioning Group in City and Hackney. But as part of my role, I'm the main point of contact for the Maternity Voices Partnership. So the local sort of parent organisation. So I work very closely with Yim, who's the chair of the MVP, and have done throughout this time. Unfortunately, Yim couldn't join us today. I think it's half term, so she's got her little ones at home. But yeah, it's been really interesting just to sort of hear your questions. And I think we're always keen to make sure that we're doing all we can locally to help women through this time, whilst we're also sticking to the guidance. So yeah, it was really helpful to get everyone's feedback and hear their thoughts.
Thank you, Shirley. Thank you, Ellie. And I think we have some expected parents at the meeting today. Would you like just to give a bit more information for the Maternity Voice Partnership? If
I can do. Yeah, so the Maternity Voices Partnership is Maternity Voices Partnerships exist all over the country, so every local area has one. So we have one that covers both City and Hackney, and it's made up of parents and parents-to-be, so that's women and their partners, who are either using Homerton Maternity Care currently or have done in the past 3 years. So we obviously with COVID we're all online now. We used to meet in the local area, but at the moment we have a sort of virtual group. So we meet every 2 months to sort of discuss issues at that time and general feedback. If anyone's interested in knowing more, then we have a Facebook group. So if you type in City and Hackney Maternity Voices, then you should be able to find both a public page and a group that you can join. But there's also an email that people can get in touch with if they want more information. So I can post that in the chat now.
And that's okay.
Ellie, it's also important to say, I know Catherine's joining us. Catherine, we have Gittit and Sarah Weiss that joined the group as well. So I'm hoping that feedback from the Maternity Voices are shared with the wider community via Sarah and Gittit.
Mm-hmm.
I don't know if Catherine can hear me. No. Okay.
No. Sarah Weiss from Interlink.
Exactly. Yeah. That's right. Yeah.
Right. Excellent. Yes, as Catherine said, we will be also happy to, promote any information that you think would be useful to go to the wider public. So we would love to share that as well. Excellent. Okay. And yes, do you?
I was going to ask Ellie. Sorry, it's Andrea here. Do you have a link? Oh, you've put the link.
Yeah.
I've just seen it pop up.
Read your voice. Did you read your mind, Andrea?
No, just because obviously if we're supporting people potentially with complaints, it's always good to be able to signpost and let people know of services that they can receive support from. So does it act as a support group as well, or is it just where people can kind of
just come and share experience?
Yeah, so we don't provide formal support in the sense of, so we don't have any kind of mentoring or support capacity formally, but obviously it is an opportunity to link up with other local parents, and also some of the women that are in the group run other local organisations, so things like the Positive Birth Movement, there's some local doulas and other things. So I think it's a good place to connect with other local parents. In terms of complaints, they should still go via pals at Homerton, but people are welcome to share feedback and thoughts with the MVP. So the purpose of the MVP is to work with Homerton to sort of collectively feedback what local women and their partners think and feel about maternity services, and kind of work with Homerton to act upon that.
Excellent.
Catherine has a
Catherine, yes, Catherine. I think you have a question, Catherine.
Yes, just thinking of some feedback that we'd had, Shirley. We had a person who was on Templar ward back in July, and they talked about feeling ignored, and when she asked questions, people said they would chase her up and get an answer, and no one got back to her. So I was wondering whether you'd had any sort of staffing issues with staff
Back at that time.
Staffing that might account for this.
No, we haven't. We've had an increased number of midwives who had to shield during the pandemic, the height of the pandemic, but we did put in additional support staff, additional staffing in the areas that to ensure that we had the right staffing. So that should not prevent a woman getting the support that she required, because all the ward had the right number of staffing that they needed during the pandemic. And if I hear about any individual feedback about women being ignored, then I certainly pick that up with the ward team, because that should never happen.
Thank you. It's reassuring to hear that you're fully staffed.
Yes, we are.
Excellent. Well, I can say that we, from our People's Feedback Panel, which run every other Friday, where we review patients' feedback that they gave us directly or published online on the provider's website. So these panels, we review this feedback, we code it, we analyze it, and then we publish insight reports, which we produce every quarter. And they are available on our website. What I want to say is that during that panels, we often come across a feedback on the maternity care, on the maternity services in Homerton Hospital, and I'm happy to say that most of this feedback is really positive, which is really good to hear. So well done on the good job you and the team are doing there, Shirley.
Thank you. We and that's really a morale boost to know that we are getting it right most of the time, not all of the time, but we strive to get it right all the time, because that's important for that woman. We know that there are some work that we need to do on our postnatal ward. We don't always get it right on the postnatal ward, and there are a number of things that we're doing. One of the things that we did do last year was put together a training video around communication and how communication feels for women. So that video was, we had 6 women who had recently used our maternity services who had fed back to us, whether it's through PALS or formal complaints, about how staff communication affected them. And they were able to give us examples when communication works very well and when it didn't work so well. And we've been able to, so with their permission, we commissioned a film company who put together a training video for us called Lived Experience, and we showed that video to all our maternity staff as part of their annual training. And we then have a group discussion after the video and say, actually, what do you think you could have done that better, and how do you think we can improve? So, that's just one aspect, and I know that the MVP is also supporting us with looking specifically at postnatal care within Homerton. So it's an ongoing process. We know that we haven't got it right, and we won't get it right all the time, but we continue to improve so that we learn those lessons and don't keep making those same mistakes again.
Good. And can you give an example of what changes you did after patients' feedback?
So in terms of changes to feedback, so one of the feedbacks we received from women is about noise at night. So that's really difficult to
maintain, really,
to address, really, because it's a busy area that have women being transferred from the labour ward to the postnatal ward during the night. But something as simple as saying to midwives, when the woman comes onto the ward, offer her earplugs during the night, and if her baby's crying, the midwives are around, so they will go to her bedside and gently wake her if she can't hear her baby cry. But something as simple as that we were able to implement. Also, women were saying to us they didn't know enough about the ward routine, so what happens when, and we've now produced a booklet where women are When they come to the ward, there's an information pack given to them about the ward routine, such as when is the medication rounds, when do you serve breakfast. So very, very simple things that we as staff take for granted, women want to know about. But also when there are specific communication or specific conduct issue relating to staff, we work with staff specifically about supporting them with additional training, opportunities for reflection with a senior midwife about how they could have improved their behaviour and their conduct. So there are numerous ways in which we continue to try to improve and get better.
Very good. Thank you very much. Thank you very much, Shirley. Does anyone has any questions for Shirley? Maybe for Ellie Duncan?
It's Andrea again.
Hi, Andrea.
Question, sorry.
Yes, go on.
I was just going to ask, what happens in regards to, I suppose, like language barriers? So I imagine the sort of cultural and ethnic sort of diversity is vast in the area. And obviously not with the COVID rules in place, but I suppose even on a sort of normal day, what happens in terms of, you know, people presenting in labour, and then there's a language barrier, because obviously, again, you can go into labour at any time, and I know that maybe sometimes these services are only available at specific times. You know, what happens in those types of scenarios?
So we have interpreting services available to us 24 hours of the day, just as you say, Andrea, because women can go into labour at 2 o'clock in the morning or 2 o'clock in the afternoon. So we can't have an interpreting services 9 to 5 because that won't suit the needs of our women and the service. So that's where needed, we provide face-to-face interpreting service, or when that's not available, i.e. in the middle of the night, then we do access language line. So that's a telephone line support that we would use to be able to ensure that we are able to support a woman's language needs at any time of the day. Yeah, and talking about interpreters within the hospital, which languages can the interpreters serve on? So we have, don't ask me to tell you what they are now, but we have the 6 most commonest spoken language in City and Hackney, okay. And we try to, the information, so certainly our parenting education video, we have translated it into those languages to ensure that women are able to access those languages. We do have some on-site interpreting service, but that's very limited. We've also, recruited bilingual support workers. So we've got some a Turkish support worker who works in that specific area within City and Hackney, and is able to provide support for women. So that's what we do. We use our support workers in that sense to support us with doing some interpreting. But in the hospital, we would either source support from language line, or do face-to-face if that's required. Also online, we have got an online service as well. So if a woman goes online to the Homerton website, there is a service called Browse Aloud. So if if she clicks on that button, the information could be read out to her, or could be translated into a specific language that she requires. Okay, thank you very much. So there were no actually on-site interpreters for the maternity care specifically. No, are the ones that the hospital uses for the whole hospital. Exactly. Yeah. Okay. Thank you very much. And I guess with the language line, the telephone line, you have more choice of languages. Indeed. And it's not limited. Yes. Very good. So do you have many? Is the number of those who are using the language line high, or not particularly high? Certainly not the language line. We don't have an increased requirement for it, but we would know if a woman is coming in that is either requires either sign language or needs interpreting. We would have planned for that. And we would, if possible, we will have face-to-face, because sometimes we know that face-to-face is always better. and we would only use telephone services if we're unable to get face-to-face, or if actually it's in the middle of the night and therefore face-to-face services is not available. We do track the number of women who's requires interpreting service, and that's information I can provide you, but I don't have that to hand now.
No, that's okay.
But we do track that information, yes.
Right, and if they require a face-to-face interpreter, will that delay their appointment? Because I guess
no, because what we will know is so we rely on our GP colleagues, because still we get quite a number of our women still going to their GP to tell them that they're pregnant. And then when we get the referral via the GP will say to us, this woman will need an interpreter and this is the language she requires. And then we will ensure that we have that interpreter available at that appointment so that it's not delayed.
Excellent. Excellent. Thank you very much. I think this is quite important, bearing in mind how diverse Hackney is.
Yes. Yeah, absolutely.
That's something that we can, again, let people know.
Yes.
Okay,
yes,
perfect. Any further questions?
And we also have our maternity helpline, which is available Monday to Sunday, 7 days a week from 10 till 6 p.m. Which women can call if they have any specific queries or questions. That helpline is not designed for you to call if you're in labour. If you're in labour, you must call the labour ward, and the midwives there will give you advice. This is just a non-labour query. If you have any queries and you're not in labour, you call the helpline.
And will that helpline book an appointment within a ward, or will just give a general? So if a pregnant woman calls and shares any concerns, will the line or whoever she speaks to be able to book her an appointment with the hospital?
Yeah, so if there is anything that she shares with because the line is facilitated by midwives, so it's trained staff that picks up the call. If they feel she'll benefit from an appointment with her own midwife or doctor, that will be organised. Or if it's a blood test that she requires, they will complete the form, book the test for her online, and say, actually, come on this day and have your test done. So yes, it does provide a range of services.
Absolutely, very good. Thank you. Well, thank you very much, Shirley. We have another 5 minutes to go before we actually end the meeting.
Sure.
I think on the sorry, I keep on speaking.
Yeah, that's okay, Andrea.
That's why you're here.
There was, I think, on the slides there was a email for the maternity helpline as well, wasn't there?
Yes, there is. There is an email. Yeah.
So people are able to use that as well.
Yes.
Or is
yeah. It's probably better to use the telephone, but sometimes the line gets very busy. So Andrea, I agree. An email as well would be good.